Good morning. As a medical doctor, I certainly understand how this coronavirus can impact our community. It's a serious challenge, but we're all working together to minimize the impact and as much as possible. The county's role in this crisis is to prepare, to educate, and to respond. And that's what we have been doing, and that's what we're doing now as an extension of that work and those efforts. Today I'm issuing an executive order declaring a state of emergency in St. Louis County. This executive order is designed to give public health officials the tools they need to prevent the spread of this virus with all the resources of county government. In other places, community transmission of the virus has followed closely behind travel-related cases. We have no reason to believe that that's not the case here, although we don't yet have any documented community-related cases. So beginning tonight at 5 p.m., organized events of more than 250 people will be prohibited. This limit is based on opinions of public health experts, the most up-to-date guidance from the CDC, and my own judgment as a medical doctor. Smaller groups and shorter contact periods work. This is a strategy that has worked before in history, and I believe it's necessary now. We hope that everyone will exercise common sense and goodwill toward our community and stay away from large gatherings. This is not a decision that I took lightly. I consulted with experts, I consulted with our regional leaders, and I prayed about it. But I believe this is the right decision. It is the kind of serious and responsible measures that our community needs at this time. In addition to limiting contact, we encourage all residents to take every measure they can to stay well. And again, I ask everyone, wash your hands with soap and water, use alcohol-based hand sanitizer when soap and water isn't available, cover your mouth when you cough or sneeze, avoid close contact with others, especially those who are sick, and if you are sick, stay home. I know that staying home is not easy for everyone, especially those who don't have a place to call home. So last night, I directed our Department of Human Services to work with our emergency management team to find ways to help those who are unhoused and others living in poverty. Missing work also often means taking unpaid time off and getting behind on the bills. Today, I'm recommending to the Civil Service Commission of St. Louis County that they adopt new, more flexible temporary leave policies for county employees. The new policy allows employees to expand sick leave, vacation time, and paid time off and comp time for COVID-19 related illnesses. No family leave paperwork will be required. And St. Louis County will allow employees affected by the coronavirus who have exhausted all their accrued leave to borrow against future accruals. If we are asking people to stay home, we must make sure that they can stay home. Yesterday, Missouri American Water announced that it was placing a moratorium on service shutoffs, and it was restoring service to customers who had been shut off. My staff has contacted Ameren and Spire to encourage them to provide relief for their customers, and I hope each will announce a plan as soon as possible. We don't want anyone who's quarantined to be forced to leave their home. I would also ask that landlords and banks voluntarily suspend all evictions and foreclosure procedures. Later today, we expect our courts to announce changes there as well. And finally, I want to thank the media for covering all this crisis and helping to educate the public. The media is a valuable tool, and we can work with us to curb the spread of this virus. We will be having another announcement later on this evening around 6 p.m. to cover the response from our medical professionals, our hospitals, and our treatment plans moving forward. And now I'd like to recognize our prosecuting attorney, Wesley Bell.
Thank you. Our role remains unchanged, and our focus is on keeping the residents of St. Louis County and our community safe, and we will continue to do so. We have established internal protocols and policies within our office to make certain that we can continue to do the work that we're required to do. Also, I'm encouraged by the cooperation and collaboration of all our St. Louis County partners, including the county executive, law enforcement, as well as state entities as well. And we would just encourage everyone to make good decisions, make certain that if you're not feeling well, that you are staying at home, and we would encourage anyone to, if you have any questions, to contact the County Health Department hotline at 314-615-2660. And I'll repeat that number again. That hotline number for the County Health Department is 314-615-2660. Chief.
Thank you, Mr. Bell. Thank you, County Executive. As you know, one of the most important things that we can provide in public service is continuity of operations. You want to know, and you should know, if your fire department's going to be there. You want to know, and you should know, if your paramedics are going to be able to come to your house. Same thing with law enforcement. As an example of that, I met with the St. Louis Area Police Chiefs Association yesterday. We talked about continuity of operations. We talked about covering for each other should that happen. Frankly, we're going to use the fire service as a guide, as an example for us on really what that looks like and what it means. We know what we're going to do if we see an erosion in our staff. We don't expect to see that, but if we do, we know what we're going to do with that. And I guess I would close with this. Unfortunately, ladies and gentlemen, I've seen the Emergency Operations Center activated more than I wish I would have, whether it's a tornado or flood, unrest, whatever else it may be. But I want to assure people, what is happening in the EOC over the last several days with the 24/7 activation is remarkable. I have never seen the EOC working in the manner as effectively as it has ever been. That should assure people, because what we want to do is we want to have the most reliable information that we can possibly provide for folks to consume, because we want to keep everybody safe. After 34 years of doing this job, I can also tell you this. I have a tremendous amount of confidence in the citizens that we serve. I know with the emergency order, there's going to be a few things that are unusual, but I have a lot of confidence that all our citizens are going to do the right thing. And in law enforcement, the fire service, our paramedics, we're going to be there to assist you with that so we can all move forward through this crisis. Thank you.
Thank you. Let me sign this, and then we'll take some questions. Okay.
How will you enforce, or is there any enforcement plans for this limit, 250-person limit?
So I'll comment on that first. You know, I think our community, watching what's happened in the world and watching what's happened in our country, will not need a lot of encouragement to follow our guidelines. We're depending on goodwill and common sense for people to make the right decisions and make good decisions. There may be occasional outliers. I'll let prosecuting attorney and chief comment on that. But I really think our community is just looking for guidance. We've done something extraordinary here. We are getting in front of the group size question before we have a confirmed diagnosis in our community. I'm doing that because I believe in the judgment of our health experts, and in my judgment that community transmission is here. It's just unrecognized because some people have mild symptoms, and it's also unrecognized because this is a new disease. We do not have a robust testing environment for it, and there are folks with symptoms who, because of the restrictions placed on us by the CDC, have not been able to get tested.
How many test kits are there, and do you feel that that's enough?
I don't believe we have enough testing in our country or in our community. We do not have enough testing vehicles or tests or places, and that is because this is a disease that's about 90 days old in America, and we just don't, it just hasn't been built yet. But we're building it as fast as we can. But we can take care of people without tests, and that's a very important message. You don't need a test to do the right thing. If you have symptoms of a cold or a flu, the right thing to do is just self-quarantine and isolate and keep away from other people. It might be too cautious, and you might not have the coronavirus, but you might. And we have enough of a challenge in our community, and we need to err on the side of caution.
What areas in the community have you identified for emergency quarantine, should things really heat up?
So you mean locations to place
Right.
people? We're working on our plans now. We're not there where we have to isolate people or segregate people, but we will make sure we have places for people to go. Most people will be able to isolate or quarantine in their homes. There are people for that won't work, and we're developing contingency plans for that. We're not there yet. We believe that if we get out in front of this with more, restrictions that are a little bit at the leading edge of what's happening in our country, that we can stop the spread in our community while we stand up our medical community's response. And we'll be talking again about the medical community response at 6 o'clock tonight.
Dr. Page,
Yes.
gatherings of 250 people or more are only a fraction of people's social lives and regular lives. What else should people do? Do you recommend that people, don't go to dinner or?
No,
don't meet with their
I would
friends?
follow the 250 size limit and be smart. If you're sick, stay home. If you've been around someone who's sick, stay home. But otherwise, we need to continue to run our community. We need to continue to run our services, and we need to continue to take care of each other. We also need to think about our spiritual well-being, our mental health. There's nothing wrong with going to a park, going outside, walking around in your community, and keeping your social engagement live. It's important that people are interacting with each other.
What was behind the 250 numbers? I know the city announced yesterday that there are 1,000, a similar restriction on 1,000 people. Do you think that's not
250 is what's recommended for mild to moderate presence of coronavirus in your community. We don't have a diagnosis of a community spread yet, but I believe that we have it here in our community. Our public health experts believe that it's here in our community. And if we can slow down the spread while we stand up our medical response, I think that we will move through this in a more organized way. And we're going to have to deal with this. It's going to be here in our community. People are going to eventually get sick, just like they get sick from the flu. Some people will be sicker than others. But if we can delay that activity and we can spread that illness out over time, our hospitals will have a better capacity to take care of everyone.
I have one more question. Can you give us a sense of why doing this is, how it can limit the spread of the disease?
This disease is spread by person-to-person contact, by coughing or sneezing, some possibly on contaminated surfaces, but the most aggressive and easy way to spread this is person-to-person contact, and we just need to keep distance between people who are at risk to spread the disease, and we need to keep, we know for sure that if we can keep large groups of people from congregating, we will dramatically disrupt the ability of this virus to spread in our community.
Are there any exceptions, church services, that's just across the board every?
There are some activities that are constitutionally protected, like religious activities. I would hope that our faith-based community will follow these guidelines. It doesn't mean they can't meet in worship. It doesn't mean they can't get together. We hope they would respect our recommendations and our guidelines on the size of crowds. We hope that their services can be divided up into different rooms. There are many ways to continue to worship, continue to address your spiritual health without getting together in groups of over 250.
Would you like to see like fish fries canceled or just?
Outdoors events are less of a concern, obviously. We're worried about enclosed spaces, but I would like to see the 250 limit respected. Yes?
Would schools violate 250 in regards to this?
So constitutionally, I don't have the authority to impact schools. They have a separate authority through state government. I suspect that they will be interested in our opinions, and they're making their own decisions all over the country right now.
Now, you said you're pretty sure that there are more cases out there that we don't know about. Do you have any, can you expand on that a little bit?
No, we have people reporting symptoms all over our community. We have many people who've traveled all over the world to areas where the virus is not as intense as Italy and China and Iran. But we are watching what's happening around the country, and we know that after a travel-related illness is recognized, within a couple of weeks, it's in the community, not necessarily from that one illness, usually not. That's just representative of what's happening in the community.
What do you say to the folks who think this is overblown?
I wouldn't know what to say if someone's making that judgment. I don't think anybody thinks, too many people believe that anymore, but I do think that we need to be thoughtful, and there's no reason to panic. This is a serious public health threat. We have the infrastructure to deal with it. In our community, we're ahead of it, and you know, our emergency operations, to me, is inspiring to see how these folks have stood this up so quickly over the past 2 weeks and are working together and making sure that the basic government services, our hospitals, our fire, our police, are going to be there when you need them.
So you're confident the lights are going to stay on, there'll be water?
The lights are going to stay on in the St. Louis region. There will be water, there will be food. We just need to be smart. We need to slow down the spread of this virus in our community while we stand up our medical response, and that's what we're trying to do.
The health department director, we asked a question. There's some question about the symptoms that would then warrant somebody to be tested. A temperature of 100.4, is that the level? And as far as testing goes, can you give the instructions? We get emails from people saying, I called all the hospitals and clinics and they won't test me, but that may not be the proper procedure for them to follow in order for the determination whether or not they should.
So I'm actually going to have Dr. Doucette speak to that. She's our Chief Medical Officer and can speak to the clinical protocols.
Certainly. So right now, there are specific protocols for symptoms and exposure history that warrant testing. As more testing becomes available, those protocols are changing regularly. So as more testing becomes available, we will look at expanding the pool of people that we believe should be tested.
So those are the ones that are the CDC-approved guidelines, but if they go to their primary care physician, they don't meet those CDC guidelines. Are there tests at the private labs that your doctor could say, you don't follow after that, but I can still have you get tested and sent to a private lab? Is that being utilized? Are there enough labs and tests to do that?
So the capacity to continue to roll out that testing is expanding in this community. So over time, we expect those guidance to change, and certainly that is the case, that over time we will be able to test more people, and with you know, the recommendation for what the screening guidelines will change. We will continue to work with our healthcare community to support that regionally, and to really make sure that we are being as consistent as we can across the healthcare community about who is appropriate to test.
So about how many tests do you have, and are you expecting to get more? Do you have some on the way? Do you know in a week we're going to have this many, or any numbers?
Yeah. I wish I could be more specific about numbers. We are not in a place right now in the United States where we can really be specific about that, but certainly multiple private and public agencies are expanding testing access very quickly.
We get these questions all the time about why can't we have more tests? We don't have enough tests. We know. And we have to take care of people the best we can until we get more tests. No one's going to argue that we don't have enough tests, but we don't have the capacity in our country to build these tests yet. And we're scaling it up as fast as we can, and as soon as we get them, we'll have them out in the community. But we have to be able to take care of people and take care of patients until we have more tests than we have now. And we can do that. We can take care of people without tests. We can make decisions without tests. And when we get more tests, we will make them available as fast as we can.
Do you feel like you're kind of fighting a battle without all the ammunition you need?
Well, certainly, but that's how every public health crisis is. It's new. It's not well understood. It's not well documented or developed because it's new. And we're creating the infrastructure to fight this as we speak. This is 90 days old, and it is not something we've seen before. We've seen this model before. We've seen the epidemic model before, and the treatment of that is hundreds of years old. It's quarantine, isolation, and try and take care of people.
Are you able to give us an update on how many people have been tested so far?
So how many people have been
Tested so far?
so the number, yeah. So we, in St. Louis County, we are running somewhere between 3 and 5 tests per day. And so that has been kind of based on the criteria that are set by the CDC and the State Department of Public Health right now.
So I just want to say something to that, though. As we expand community testing and private labs get engaged, it won't be possible to characterize that number as it continues to move forward. So currently, we're aware of the number of tests that we have sent in cooperation with the state lab from the CDC's process. But we won't be able to know, like we will know broad numbers with our community partners, but the access to community testing will change the availability of that number because it will just begin to expand pretty rapidly.
Dr. Page, you said just 2 weeks ago that you had a lot of confidence in the federal government's ability to help contain this outbreak. Do you still feel that way?
I have a lot of confidence in our country to get through this, and I have a lot of confidence in our ability to use the resources we have to take care of people. I think we've all changed our opinions about what's happening as we get updates, but certainly, we've learned a lot over the past 24 hours and the past week. And we make decisions and judgments with the information we have at the time, but I think we've got a good plan moving forward. We can see what's happened around the rest of the world. We can see what's happened in the United States. And I believe we can get through this if we adopt these procedures and outline and protocols that we have in place.
In St. Louis County government, how many people work for you, and what percentage of them do you expect to not come to work next week?
Oh, we have contingency plans for every department that are being implemented to make sure that we continue to provide basic services. We have, 4,000 employees in county government, and we expect them, unless they're symptomatic or they've been exposed to someone that is known to be sick, then we expect them to continue doing their job. Some of them will work from home. We'll follow the large gathering guidelines like everyone else. They'll be interacting with members of the public and public-facing responsibilities with a minimal touch, low touch sort of social distancing procedure.
So unclear really how many people, obviously, police officers can't work from home, but.
Right.
In
So all of our
government, do you expect most of your staff to be working from home?
No, I expect most of our staff to continue to do what they're doing. And I expect most employers in town will have their workers to continue to do what they're doing. And we'll follow the group gathering guidelines and common sense, social distancing, but we have to continue to provide government services, and we're going to do that. Yes?
How real is the threat that the virus now could jump to the animal population and then be reintroduced to the human population with some immunity to a possible?
So it's almost impossible to characterize at this point. So there is some really new science that's coming out in a variety of different places. Science requires repetition and it requires replicability to make sure that those are things that can in fact be said as fact. So I can't speak to that in particular. We do get lots of updates on scientific articles and information, and we are certainly watching them and following them, but it does take a certain body of knowledge in order to provide policy level guidance on what a particular threat may be.
Yep.
Yesterday
Questions?
was really scary for a lot of people around the region, I'm sure, hearing about everything closing. This question could be for anybody. What would you tell the public right now who might be freaking out?
Okay, I would say that 4 out of 5 people who become infected with COVID-19 have mild symptoms, recover within a few days, and go on with their life. The other 20% are sicker, and a subset of those require hospital care. A subset of those require more intensive care and get sick. The folks that are more likely to struggle with a COVID-19 infection are older folks with chronic medical problems, and that's why it's more important that people in high-risk groups take special precautions. And for those folks in high-risk groups, I would really think about going to any sort of crowded event. But this is new, and things that are new are frightening. But I think we know what we need to do here, and we know that these measures work, and we're taking a little bit more aggressive stance with the assumption that this is in our community, and we think it's the right thing to do. Yes.
Dr. Page, some larger cities are implementing and have plans for drive-through testing to keep people out of emergency rooms. Has the county planned on potentially?
Yeah, we're working with our hospital systems and our community partners to stand up more robust testing as fast as we can, and we expect to be seeing more of that in the coming days for sure.
Dr. Page, you mentioned, order, you now have given public health access to basically everything in government. What are the things that allows them to do, health officials and others, that maybe they weren't able to do before you signed this order?
Well, it makes it easier essentially for purchasing supplies. It makes us easier to get our hands on things that we need. It allows us to give direction on behavior in the community. Those are the main tools that we have.
Yes, that is predominantly the case.
What about the economic impact? Have you thought about that yet? I mean, you're gonna lose some tax revenue and it's
We
gonna.
think about that all the
take a
time,
hit. Is that-
and that's, we see that through history. And you have to balance the economic impact of your decisions and the public health impact. And, but we believe that the decisions we're making today will save lives, and it's the right thing to do. And we're going to do it in a thoughtful and responsible way that we try to minimize the economic impact in our community. We'd like for businesses to keep going. We will continue to provide essential services. We think limiting crowds will have a big impact. We think people making smart decisions about whether or not they need to be out based on their own personal health, whether they have chronic illness or whether or not they may have been exposed to someone who is sick or they may be sick themselves. I think it's really important for people who feel like they might have the flu or they might have the cold, they have a sore throat, have a fever, stay home. Any other questions?
Thank you,
Okay,
everybody.
thanks a lot.